Welcome. Here at Shannon, our mission is to provide exceptional care to our family, friends, and neighbors. Today, we have the unique opportunity to bring in team members across the organization to listen to their stories and for them to share insight at how they personally make each patient experience individualized and how they support our mission, vision, and values.
So how can you ensure that a patient and their family members have a positive experience?
My main thing is I always make sure that I always greet patients with a smile. I want them to feel like they're part of my family. I want them to feel comfortable coming to Shannon. I want them to feel comfortable asking questions, or if they feel lost, I want them to be able to ask that question, and we need to get them to where they need to be. So always greeting them with a smile. I'm a little bit of a hugger, so I may give you a hug or two, and I just want them to feel at ease when they're at Shannon and feel like they're going to be well taken care of.
Listening, being compassionate, making sure their concerns are addressed, or if I need to pass on information, that the information's passed on. But I also love laughing and sharing stories with them, and then sometimes it makes them open up even more what's truly, bothering them. Having the conversation and the intimacy with them, it really is neat. I just love patient care. I love being a bedside nurse, and I couldn't be more grateful to be in the position that I am.
For a community recovery nurse, the anesthesia is high in effect, so patients are very disoriented. They're very sometimes scared coming out. I'm having to reiterate and reorient them constantly within the next 30 minutes or so, and making them feel comfortable and safe. But also the main key is treat them like their family, I guess, with a loving heart, and they'll open up a little bit and be more receptive to the care.
In your role as a nurse, how do you feel like you keep patients informed about their care and heighten their patient experience?
So I think having clear communication, open dialogue, and active listening are some of the big things that patients are looking for. Being in the hospital can be very scary for them and their family members. Yeah. So just trying to have everyone as well informed as possible is crucial, so they feel like they have a say in their care. Also, patient education. Sometimes they're having tests done, or there's a lab value that they've never heard of. They don't know what it means, and it is my job as a nurse to make sure they understand what it equates to and how that interacts with their treatment and care plan.
One of my top priorities is patient education, and I think that goes a long way, just explaining the medical terms and words that make sense. So, you can't have water because if for some reason you need surgery, that would halt your life-saving surgery. Or, if you're over here eating your McDonald's that your family member brought you because they're so nice and love you and want you to have food, that might make your problems and your symptoms way worse. Understanding of why we do what we do and why we're doing it. And I think once they understand that, it helps their experience kind of flow a lot easier. They know more what to expect and what's to come with their care while they're in our department.
I think being able to provide a good support to our family members that are there with their loved one, trying to fill the gap, because they could be the family member down the hall from the treatment room where the patient is. And sometimes, even though that's can only be 50 to 100 feet, it can feel a world apart when your loved one is down the hall and in an emergency situation. They're uncertain about what's going on, and they know that there was some kind of an event that led them to being treated in the ER in that moment. Helping just kind of assess, or trying to help to fill their way around what information that would be helpful for them, to be a support, but also not be burdensome for them. There's kind of a balance that we try to strike for the two.
What role do you play in creating a positive patient experience in the department that you work in?
We meet with the patients if they have any concerns, or if they're needing any assistance with filling out their menu selections. We can visit them daily and get their selections if we need to. For example, if they can't hear or they really can't see very well, they're going to need some assistance in getting their menu filled out. Us meeting with them, they enjoy having that control, maybe to to choose what they would like to eat, but still kind of stay within the diet that they've been prescribed.
I always make sure I greet them when they walk in the door.
ask them how they are, and just try to make the process as quick as I can. Get paperwork signed, all that kind of stuff done quickly. If they have any questions and concerns, make sure I can help or get somebody that can help them.
I spend a lot of time with family members and just sitting with them, getting to know their loved ones. You know, they're critically ill. You know, tell me who they were before they came in here so that we know kind of what we're working towards to get them back to who you know as their loved one.
How do you feel that compassion plays a crucial role in patient experience, and how can we improve that?
I think compassion is critical for our patients' experience. It's showing our patients and our families and really one another kindness and empathy so that we can create a healing environment. And to do that, we have to be willing to listen, to really hear the feelings of our patients, to perspective take, because it feels vastly different to them than it does to us. We need to validate their feelings and really work hard at keeping ourselves out of judgment.
A couple of years ago, we had a patient in the emergency department that was having chest pain, and it was double difficulty for him because it was his birthday, and he was anxious about the chest pain that he was experiencing. And the nurses pointed out that it was his birthday. So we found a slice of cake from the cafeteria, and one of the nurses found a candle that had been left over from an employee's birthday party. And we lit the candle and went into his room and sang happy birthday to him and gave him the cake. And at the end of the day, he was fine from a cardiac perspective, but I think it alleviated a lot of his anxiety and sadness about the difficult day that he was having.
Thank you for taking the time to learn the heart of Shannon. Trust is something that we deeply value, and we are hopeful that we can provide world-class experiences.